Hello everyone, I hope you are doing well. In the previous videos, I had discussed about pharmacokinetic and its first step absorption, second step distribution, and third step metabolism that was divided into phase 1 and phase 2. Today, I will discuss in detail excretion of drug and different routes used in excretion. Excretion is the passage out of the systematically absorbed drug or its metabolites. It is the process by which drug or its metabolite is eliminated from the body. Drug may be excreted unchanged or after the biotransformation. Drugs are excreted through the different routes. These include renal, biliary excretion, pulmonary excretion, excretion through GIT, excretion through minor routes, and excretion of drugs through maternal milk. I will discuss in detail one by one. Okay, let's start with renal excretion. What is renal excretion? It's the major route of excretion of drug. The drugs are excreted through the kidney. Kidneys. First, we will learn that what is glomerular filtration. What happened in glomerular filtration? The drug is carried to the glomerulus through afferent artery, where filtration of drug takes place. Drug is filtered through glomerular membrane and the plasma constitute, that is, red blood cells, white blood cells, and proteins are unable to pass through the glomerular membrane because of their large molecular weight. The glomerular membrane has large number of pores for the passage of drugs or their metabolites. After filtration, the drug reaches into the woman's capsule and then is passed into the proximal part of the renal tubule. The lipid solubility and pH do not influence the passage of the drug into the glomerular filtrate. The glomerular filtratability of drug depends upon the following factor. These are different factors we discuss in one by one. That is size of the drug, large protein drug bounding molecules, and hydrostatic pressure. Drug molecules or its metabolites having molecular weight less than 500 atomic mass unit can easily pass or easily filtered through glomerular membrane. Otherwise, it cannot pass. For example, tranquilizers, that is diazepam, lorazepam, and barbiturates, that is phenobarbital, cannot pass through the glomerular membrane because their molecular weight is greater than 500 atomic mass unit. Large protein drug bounded molecules. Second, that is large protein drug bounded molecules are unable to pass through the pores of glomerular membrane, as well as the protein binding reduces the availability of drug at glomerular level because phenylbutazone has protein binding, that is 98%, and is unable to pass through glomerular membrane. Similarly, the synthetic penicillin such as phenoxymethylpenicillin, cloxacillin has large protein binding, that is 80% and 95%, and are unable to pass through the glomerular membrane. Third, we have hydrostatic pressure. The driving force in the glomerulus is the hydrostatic pressure, which results in the filtration of drug molecules. Both the polar and non-polar molecules are passed through the pores of glomerular membrane. Now we move towards the active tubular secretion and reabsorption, that is second type of renal excretion. What happen in it? Active tubular secretion takes place when the ionized drugs and large protein bounded drug molecules are unable to pass through the glomerular membrane. Such ionized drug, that is cationic or anionic, are transported into the lumen of the proximal tubule by active transport process. Such ionic form of the drug are not reabsorbed into the blood and are excreted through the urine. What happened? Most of the acidic or basic drugs are their metabolites are excreted into the lumen of proximal tubule, that is active tubular secretion. The acidic drugs are penicillin. Other antibiotics are cephalosporins, thiazides, cimetidine, ranitidine, and salicylates, while basic drugs such as pethidine, morphine, amphetamine, these are secreted into the lumen of proximal tubule. The acidic drugs or their metabolites are reabsorbed in the acidic media. Because the urine provides the acidic media, or lipid soluble drugs are reabsorbed in the renal tubule. The reabsorption of the acidic drugs or their metabolites is inhibited by forced alkaline diuresis, that is, to make urine alkaline in the presence of diuretic agent, where the basic drugs or metabolites are dissociated into ionic form and are not absorbed into the renal tubule and are excreted through the kidney. Thus types we have passive diffusion. It is the bidirectional process, that is, it takes place on either side of the renal tubule. This process takes place when the glomerular filtrate reach in the renal tubule, as well as the drugs or their metabolites are secreted into the lumen of the tubule by active transport process. Passive diffusion takes place in the proximal tubule as well as in the distal tubule. Passive diffusion depends upon concentration gradient, lipid solubility, pH as the medium. The pH of the medium plays an important role, that is, it determines the rate of excretion of drug. When acidic drugs are reabsorbed, urine is made alkaline to prevent their reabsorption. When the glomerular filtrate is made alkaline, acidic drug in it will be ionized and the condition will be unfavorable for the reabsorption. This is done by forced alkaline diuresis. The forced alkaline diuresis is done by sodium bicarbonate injections and diuretic agents, that is furosemide injection in the form of infusion or drip. Forced alkaline diuresis is very important in salicylates and barbiturates poisoning because these are reabsorbed. Sodium bicarbonate makes the urine alkaline, while the furosemide increases the volume of urine excreted through the kidney. Alkaline diuresis inhibit the reabsorption of acidic drugs to decrease the plasma level of the drug, to increase the excretion of the drugs. These are the different functions performed by the alkaline diuresis. And in short, if we conclude the renal excretion, it is summarized as lipid soluble drugs or their metabolites are reabsorbed in the renal tubules and are excreted by the change of pH. Polar or water soluble drugs are excreted out through the kidney. Conjugated drugs act as polar molecule which are excreted through the bile and urine. The major route of drug excretion is the glomerular filtration. Now I move toward the second type of excretion, that is biliary excretion of the drug. What happened? It is the excretion of the drugs or metabolites through the bile. Many drugs or their metabolites such as ampicillin, tetracycline, rifampicin, isoniazides are secreted into bile. Then it is a significant mechanism of active secretion of certain drugs and large conjugates. The drug through bile duct reaches the small intestine. Then the drug is excreted through the feces because it is not reabsorbed because it exists in the ionic form. The large conjugated drugs pass through the liver into the bile and then reach to small intestine through the bile duct. Such ionic form of drugs are excreted in the feces. Third type of excretion is pulmonary excretion. It is the excretion of drug or their metabolites through the lungs. The lungs is the most important route for excretion of volatile liquids, gases, and general anesthetics. For example, ether, peraldehyde, and alcohols are excreted through the lungs, right? Next we move toward the fourth type, that is excretion through the GIT. Those drugs which are unabsorbed are excreted through GIT. These are the drugs which act locally because magnesium trisilicate, which exists in magnesium and silicate ions, these ions being heavy ions and are not absorbed but are excreted through the feces, as well as the drugs or metabolites which pass from the liver into the bile and reach into small intestine are excreted through the feces, such as large conjugated metabolites are excreted through the feces. Now we move towards the fifth type, that is excretion through the minor routes. These are very rare routes for the excretion of the drugs of the metabolites. These includes excretion through the saliva, excretion through tears, and excretion through sweat. Excretion through saliva, when the drug are given orally, these are absorbed from the buccal cavity. Very minute quantity of the drug is excreted when the person splits out. Excretion through tears. It depends upon the situation. When a person weeps, the drug is excreted throughout the tears. Excretion through sweat. It again depend upon the situation, that is in very hot season the drugs are excreted out through the sweat, for example thiocyanate ions, right? Now we move towards the excretion of the drug through maternal milk, that is last type of excretion. What happens in it? The mammary glands constitutes an important route for drug excretion. Maternal milk act as lipoidal vehicle. Thus, the breastfeeding infants might be adversely affected by the drugs given to their mother. The breastfeeding infant is affected by the drug intake in the mother milk. For example, maternal ingestion of morphine and other narcotics, some hypnotics, large amount of alcohol are likely to produce infant sedation. The tetracycline may cause teeth staining and deformities of bones in the breastfeeding infant, while the purgative cause infant diarrhea. Here I conclude the pharmacokinetics and its different steps involved in it. In the next video, I will discuss different route of drug administration in detail. For more information, like, subscribe my channel. Thank you.